I would call upon Ed Moon come. Oh, excuse me, John Black, Dr. John Black.
I'm going to do it your way.
I'm John Black. I practice general internal medicine in West Columbia. I'm president of the South Carolina Medical Association. Excuse me. I've been in West Columbia since 1980. I'm going to give you an example. I see a lot of heart patients. I treat a lot of heart disease. I can treat congestive
I'm sorry,
heart.
tell me what your profession is again?
General internal medicine.
Okay, you're not an ophthalmologist.
Not an ophthalmologist, but
Okay.
I'm going to give you an example that's similar to what we're talking about. I can treat a heart attack, congestive heart failure. Somebody can come in with atrial fibrillation with a rapid rate of 180 a minute. I can treat all that. In training, I put catheters in the veins and arteries and did pretty well at it. But I'm not going to do a cardiac catheterization. And I'm not going to try to put a stent in a heart. And I could argue that Dillon doesn't have someone that can do that. I grew up in Dillon. Or I could argue that Barnwell doesn't have anyone that did that. My daddy was born in Barnwell. I could pick any little town in South Carolina. But y'all would laugh me out of this room if I came here asking y'all to give me the credentials to do something that's now done by a cardiologist, and that's the standard of care. So what we're really talking about here is credentialing and standard of care. And all of us would agree that we're much more sophisticated now than we ever have been. My dad was a doctor in Dillon. He had 1 year of internship. He delivered probably 4,000 babies in Dillon during his career. He became the obstetrician. He did surgery. Well, that's not the standard of care now. We've advanced. We've become a lot more sophisticated. And this is not the time to go backwards and to say that someone who did not go to medical school can do things like stick a needle around the eye, take off lesions around the eye, and prescribe every medicine in the PDR except for controlled substances is what I understand. That's the purview of a medical doctor. And we're talking about safety. I have friends that are optometrists. They're nice people. They're people in our community. But they're not doctors. They're not physicians. And it's very hard to understand why they keep coming back every year trying to change their scope of practice. Well, it's not hard to understand. They want to advance what they can do. But you don't do it by legislation. You do it by training. And to be a competent eye professional, one has to be a physician. If any of y'all needed any significant eye procedure, I think you would want an ophthalmologist to do it, just like you would want a cardiologist to take care of your heart. The physicians have to protect the public sometimes, and it looks like we're trying to protect our turf. But who's going to protect the public if they don't know that they're at risk? It's us. And so we're going to be here trying to explain that. Legislators have to protect the public. Your constituents are counting on you to do what's right for them. And when they walk into an optometrist's office and expect to get the best care, there have to be limits there. They've not had our training. I'd have to go back to fellowship in cardiology for 2 years to do what I was talking about a minute ago.
Let me see if any of the committee members have questions for Dr. Black. Representative Ballantyne or Representative Hart? I appreciate you being with us, Dr. Black.
Just think safety. Thank you.